This is Doug Brunk reporting from the annual meeting of the American Urological Association in San Diego. A study of more than 6.2 million men with ED found that only 25% are receiving treatment.
To date, several small survey-based studies have suggested that erectile dysfunction is largely undertreated, but in large populations, this is really kind of unknown. We identified over 6 million men in the IMS data set who had a ICD-9 diagnosis of erectile dysfunction. Surprisingly, only a very small relative percentage of 25% were actually treated with a medical therapy during the one-year study period. Not surprisingly, when we looked at the actual type of medical replacement therapy, we do see that the PDE5 inhibitors, the oral agents, were the most frequent prescribed. But interestingly, and these are not unique, so some patients are actually taking multiple therapies. There was almost a third of men who were actually taking androgen replacement therapy. The lowest was the injection therapies, which are shown to the right on that graph. When we looked at the percent treated as a function of age, I was actually rather surprised, and specifically, as I previously said, is that age is a risk factor for ED, and the prevalence of ED increases with advancing age. But interestingly, the men who were in the oldest age groups, meaning greater than 60, were actually the least likely to actually fill a prescription compared to the 40 to 59 age groups. There's also the lowest percentage, or a decreased percentage, amongst men who are less than 40. When we look at the type of therapies as a function of age, once again we confirmed that the phosphodiesterase inhibitors, shown in the kind of purple boxes here, are the most likely in every age group to be filled. But when we look at hormone replacement therapies, men in the oldest age group, greater than 65 and less than 40, were significantly more likely